Qualifying for QMB when over the income and asset limits. The Qualified Medicare Beneficiary Program is a Medicare savings program that reduces medication and health care costs. We're going to discuss how to qualify for QMB when you are over the financial limits set by the government. Let's review the benefits of QMB. You get extra help for your prescription drugs, which means your medications will go down to $0 to $10. Your Part D deductibles are covered, and your Part D premium is paid up to a base amount. You're never in the donut hole, and your Medicare Part A and B premiums are paid back in your Social Security check. Medicare deductibles are covered, and co-insurance when you go to the doctors and the hospitals will be zero for you as long as Medicare approves the expense. For more detailed explanation, please review our video on what is a qualified Medicare beneficiary. I'd like to go through an example now. Susan is 75 years old. She's single, diabetic, and her insulin is $300 a month because she's in the donut hole. She also needs hip surgery but can't afford it. Her monthly income is $1,800 and her countable assets are $10,000. So her income and assets are too high to qualify for QMB. What is Susan going to do? We're going to talk about one option, a pooled special needs trust. Please note, AGED recommends that you consult with an elder law attorney to discuss all your options when you're over the asset or income limit. A pooled special needs trust is a type of trust used to qualify for Medicaid when you're over the limits. You can transfer income and/or assets into the trust, and Medicaid does not count them. So this is a legal way to reduce your countable income and assets. One of the rules around using the trust is that you have to be disabled. If you're under 65, that means you're on Social Security disability benefits. 65 or older, it means you have a lot of medical conditions that prevent you from working. Now let's talk about how Susan is using the trust to qualify for QMB. With her income at $1,800 a month, that income continues to go into her checking account, and every month she transfers $800 from her checking into the trust to reduce her countable income. This allows her to qualify. Her assets are also over by about $3,000. So initially when funding the trust, Susan puts $3,000 into the trust to get her assets under the allowable limit. Now, with income going into the trust every month and her assets below the limit, Susan qualifies for QMB. But she needs that money that she puts into the trust every month for her living expenses. So the trust pays for some of her bills. We're paying car payment every month. We're paying Susan's rent. There's lots of other things that we could pay for Susan as long as it's for her sole benefit. Because she now qualifies for QMB, what does Susan get? Her insulin is now $3.60. Her other meds are all $0 to $10. She has the hip surgery that she needs and doesn't have to pay anything for it. The doctors and hospitals she can afford because she doesn't have to pay anything. Also, Susan's Social Security check has gone up by $136 because the government is paying her Part B premium. By using the trust to qualify for QMB, Susan has reduced her medication and her health care costs, freed up money to pay for her living expenses, and improve her quality of life. There are over 1 million seniors and persons with disabilities like Susan in Florida who cannot afford to take their medications. They can't afford to go to the doctors or have the procedures that they need. Do you know someone who needs help? Call AGED today.